High numbers of new COVID-19 infections have been recorded across the country recently. Well, let's find out exactly how the health department is going to be dealing with this new wave of COVID-19. The Deputy Health Minister, Dr. Phaahla, joins me tonight. Minister Phaahla, good evening, and thank you so much for your time. Firstly, when we look at the numbers and we look at the various reports coming out of the province, in particular in Gauteng, about the state of the hospitals and the extent to which medical professionals feel that they have been supported and equipped to deal with this third wave, there certainly is a sense that not enough is being done.
Well, Cathy and the viewers, we accept that there will never be enough facilities for this kind of a rise. The spike has been quite steep, especially in Gauteng, as you may be aware that we have gone far beyond even the highest peak of the second wave. As we speak, over the last few days, we have breached the 8,000, including today at 8,600. So now these are just the positive tests. Clearly, over the days as people get more sick, it is going to be quite testing. Especially in Gauteng. And of course, as you are aware, we are hoping that some of the facilities that Charlotte Maxeke Hospital, as Minister Ngubane did mention, will start to open, starting with oncology, which will take a bit of the pressure. But it's going to be a real tall order to cope with the situation. And we will be working very closely with the province to try and see how we're going to manage this.
So one of the difficulties, Dr. Phaahla, is that the department seems to be caught off guard, that it is reactive to the number of cases that we're seeing, and that not enough measures were put in place in the first instance to prepare for any likely scenario.
Well, not exactly. I mean, we've been always on guard with the understanding that the likelihood of a third wave was always going to be there, especially, the only safety going forward, we know that as more and more people get vaccinated in the future, we'll hopefully be more protected. But as our vaccination program is just picking up, the advent of this third wave was always going to be a challenge. So it's not that, what happened at Charlotte Maxeke was not planned in terms of the unavailability of just over 1,000 beds. So we have to work with the province, working also with the private sector to make sure that that deficit can be catered for. At the present moment where we are, our facilities are not as yet overwhelmed. But over the days and weeks, if these numbers continue, clearly we have to look at other means in terms of, making sure that, other plans like surgeries can be delayed and more people who are stable.
We're already seeing several hospitals, including the Chris Hani Baragwanath Hospital, delaying surgeries and postponing surgeries because they simply don't have capacity in terms of dealing with patients. So the sense that we're getting from health workers, whether in the private or the public sector in Gauteng, is that there aren't enough resources to help deal with the current cases, but most importantly, with the likely cases of from this disease in the next week or two.
Well, as I'm saying, this is, you must remember that as much as we knew that there will be a third wave and we have to have contingency plans, this is a kind of pandemic which has no previous, nobody can say they have very clear scientific prediction of how it's going to pan out. I'll tell you, for instance, that when we discussed with our modelers a few weeks ago and a few months ago, what they said to us was that it was quite unlikely that the third wave would be of a higher rate than the second wave. But we had to make sure that, nevertheless, because nobody can say that with certainty, that working with all our colleagues in the provinces, we must prepare for the worst scenario, and which is what we are getting now in Gauteng. So I'm saying to you that, I mean, I can't say to you and to the public that we knew exactly where the peak of this third wave was going to emerge. You know, if you look at the first wave, different pattern, second wave, different pattern. So as much as we're making plans overall in terms of increasing our capacity, but the detail in terms of where it will emerge at what size, those are the things which, as it emerges, you have to adjust.
So, Dr. Phaahla, what was your worst case scenario that you were planning around?
Well, as I'm saying to you, that our modelers had said to us that it was unlikely in terms of, and looking at the size of the pattern of the second wave. If you remember, if you look at Gauteng, at the peak of the second wave, at the most, we had up just over 7,000 per day for a few days. And during all that period, our facilities, as much as they were stretched, but they were never completely overwhelmed. But we've been working with all our colleagues in the various provinces, not knowing exactly the exact pattern, preparing for the scenario where, as the numbers rise, you know, we all of us worked around the contingency plans in terms of increasing bed capacity, looking at both the public and the private. What are the kind of spare capacity which can be created?
So if I'm hearing you correctly, Dr. Phaahla, you've been caught off guard, because you're saying that the worst case scenario that you as the health department were planning for was around the first and the second wave. When we look at the graphs comparatively, the steep curve, the steep nature of this third wave of infections means that we're not only where we were with the first and second wave much sooner than was expected, but we're experiencing even more infections than the previous two times. So you've been caught off guard by the situation. You simply haven't prepared for it.
We have prepared, but I cannot say to you, I'm saying to you that, you know, knowing that there couldn't have been any sort of accurate, exact science which would tell you this is how it's going to pan out and at what level. In terms, you have to work on scenarios. And so every day as the pattern emerges, you have to make adjustments in terms of how, you know, because it's as I'm saying, it's not a kind of a development which you can depend much on previous experiences, because it comes always with different presentations. So I would not be telling you the exact reality if I was to argue to you to say we knew exactly on what date, on which week, and what magnitude. But we had to prepare around scenario of the fact that there will be a rise in terms of the third wave. So, but to say to you that we knew exactly at this week at that magnitude, it can't be that I can't say so. So we have to make adjustments in terms of as and when it emerges, and that's what we're working around with Gauteng, but also preparing with the other provinces.
Several doctors in Gauteng have described the situation within hospitals right now as being at crisis point. Is that the way that you as the Deputy Health Minister sees it? Is that the way that the Health Department would describe it?
I wouldn't say it is a threat of overwhelming our facilities. That's why I'm saying to you that because as it is emerging, we are starting to see a higher number than what we had expected as the rise has been happening. So we have to make those adjustments. But I wouldn't say at the current moment that we have reached a crisis point. There is a threat that increasingly, if this rise in numbers is sustained over a longer period, it might reach a crisis point.
We have doctors, Dr. Phaahla, who, again, at different hospitals. Leratong Hospital has been pointed out as one of the hospitals where there have been complaints about personal protective equipment, and that there's a shortage of PPEs at health facilities within the province, at least. What do you know about that?
Well, we monitor. We've got a system through which, working with provinces as they report, we are able to monitor together with them the availability of the personal protective equipment. At this stage, there might be areas in terms of day-to-day management where there might be some shortcoming, but as far as we know, we don't have a generalized shortage in the Gauteng province.
So what does that mean? If you're saying that there might be a general day-to-day shortage, it means that is a doctor, is a nurse, is any kind of official that is working in any of the province's hospitals, are they able to access the PPE that they need in order to carry out their functions? Can you say that for all of our hospitals?
It's not possible. I can sit here and tell you that. I can tell you now, as I'm talking to you, what is the stock level as we are speaking now at King Edward Hospital or at Tygerberg Hospital. We monitor in terms of availability, in terms of our stock visibility system, the availability of various equipments. But remember that you can have, even in a district, masks and other aprons and other gloves and equipment available. But at the end, the reason why I would really, not take a chance and say to you that seated here, I can tell you in every clinic, in every facility, what is the stock level, because all those also depend on this management at the district level, management at the facility level on a day-to-day basis. So it's important that where our health workers experience that, they need to report. If they don't get joy at the district or provincial level, they can elevate that to our attention so that we can take it up. Because even when systems also depend on how people manage and use the system. So if you have managers and even at the lowest level, even though there is no generalized shortage, if they don't manage their stock properly, then it's only when the staff on the ground raise the complaints that we will be able to follow it up.
What are you, as the health department, going to be prioritizing going into this week? There's a lot going on. You describe it as a threat to overwhelm the province's hospitals, especially in Gauteng right now. The doctors say it's a crisis. We also have the vaccinations of teachers that's set to begin in earnest this week. What are you going to be prioritizing as the health department?
Well, we have to prioritize the whole value chain. On the one side, in terms of saving lives, we have to make sure that, as it is quite clear that even though the steep rise currently is in Gauteng, but you can see even from the report which you were playing earlier on, of the report of the Premier of KZN, it's all provinces. The positivity rate is rising. So on the one hand, we will be tightening up in terms of working with our colleagues in terms of looking at additional facilities, both public and private, in terms of decanting, making sure that any other admissions which are not urgent should be delayed, to make sure that more urgent, especially high care and ICU becomes more available, working with all our colleagues, of course, with the Gauteng as being the epicenter. But at the same time, we are also stepping up the vaccination program, because the two go together. You need to deal with what is an urgent situation now of people who are already infected and sick, but we need to roll out the vaccination program at the same time, so that going forward, we can be sure that a larger number of South Africans are protected from serious illness.
Let's leave it there for tonight. The Deputy Minister of Health, Dr. Phaahla.